Hi, a very good morning to all of you. Today we are going to discuss the case note of Mrs. Archie. Uh, so this is a client whom you were treating in a surgical ward. The patient's full name is Theodore Archie, 70-year-old woman, and she was admitted to your care for the treatment of abdominal pain. So let's go ahead and see the writing task. Using the information in the case note, write a letter of referral to the patient's local. So using the information in the case note, write a letter of referral to the patient's local community nurse, the patient's local community nurse. So you know that this is a noun case because it is the local community nurse of the patient. So we have the background information known. So the local community nurse know the background information, the social background and past medical history, all these things the local community nurse know. So the very recent things which we can see in the hospital is to be updated to the nurse. Now, stating all the details, you have to state all the details which happened in the hospital and requesting her to look into the case. Okay, so this is what you have to go ahead. So we are discharging the patient with a letter to the GP and the community health nurse, and you are instructing the nurse that the laparotomy wound care should be there and observation should be there for vitals and medication complaints. All these things are there. And what we have seen that in the case now we do have very little things to include. Number one, so these things we don't need to include the social and family history at all, but we need to be aware of the situation. You have to read the situation because she is having some problems with atrial fibrillation. She is using thiazide diuretics, all these things you have to understand. Okay, get the information. You just totally don't ignore the data there. You read and understand what is that, but you don't need to include that in the answer sheet. So let us go ahead and see what's there in the recent medical history. So the recent medical records, it starts from 6, the date of admission, to 9, 6, 7, 8, and 9. So the majority of these things are there. The data is there on the 6th when she got admitted, and 7 to 8 or 7 to 9 is the progress that she has made in her condition. So we have categorized these things to two. The first thing, when she got admitted, she had abdominal pain, and it started 24 hours before the admission. The local community nurse knows that she has got abdominal pain 24 hours before the admission. Right now, at the time of admission, she had central abdominal pain and vomited altered food on one occasion. This is something good. We have to, many students just write vomit once. No, what she vomited is to be written vomited altered food. This is something important. So the food which is not in proper conditions of altered food. So when we omit, you have the omitters appears different. Altered food, omitters, when you omit altered food, it represents something else. So this is what you need to focus. Now atrial fibrillation, she had atrial fibrillation before. Right now she had atrial fibrillation at the time of admission, and it was 92 per minute and the BP was 119. Now that after 2 hours the BP reduced, it fell. Now we have observation, tenderness, guarding, and we can say very less bowel sounds, just occasional bowel sounds. Don't say bowel sounds present, just say just occasional. It means a very limited bowel sound. This is what many students, they write just bowel sounds. It's not actually bowel sounds present. We are getting bowel sounds, but that's not proper. That's what we need to understand. Now we are going now the understanding the seriousness of the condition. She was moved to the intensive care unit and monitored there. Initial investigations, x-ray showed no problem, but ultrasound showed loops, dilated loops of the bowel, free turbid in intraperitoneal fluid. Those are these things, abnormal findings we can see in the ultrasonography. And we were observing her in the intensive care unit. That time we noticed that her urine output were falling. So this is what we have. And we have re-examined the patient. In the initial examination, we found that the patient had decreased bowel sound. Now the bowel sound is totally absent. Hands and feet warm. Measurements, cardiac output is going high. Now arteriography, we have understood that she had vascular occlusion in the mesentery. So we have to confirm it with the laparotomy, and we did it and removed the necrotic bowel part. And after the operation, she was stabilized, fluid replacement and antibiotics. Then we can see that the patient's condition is improving. Her sepsis parameters, that is fever, all these things are going down. Now she's ready for discharge after removing the drain. Now let's go ahead with the presentation. That's today's date. The address of the local community nurse, this dear Miss Flex. Reference Miss THEODORE ARCHIE, 19 September, that's the date of birth. I'm writing to update the current health status of Miss THEODORE ARCHIE, who requires ongoing care and management from you. She has undergone a laparotomy procedure for an ischemic bowel secondary to an embolus. So we have written the purpose clear. Now, Mrs. Archie was admitted to our care on 6th January 2021 with constant abdominal pain, which was located at the center, central abdominal pain. When it started, the local community nurse know, because it started 24 hours before the admission, so she might know. She might have referred her to the hospital. So she also reported to have vomited altered food once. Examination revealed that she was on atrial fibrillation at a rate of 92 minutes per minute with a BP of 11476 mmHg, which fell to 8460 in just 2 hours. So a sharp fall is seen. In addition, her abdomen was tender with some guarding and very limited bowel movement. Okay, consequently, she was admitted to the intensive care unit for close monitoring. Although her X-ray showed no major abnormality, an ultrasound was taken later, which revealed a dilated bowel loops and free turbid intraperitoneal fluid. Her urine output also fell substantially. Okay, so this is what we have seen about Mrs. Archie at the hospital, how she came, what we observed. This is what we examined. We examined further what happened to her. Now, what happened to her is that it was shown in the arteriography that occlusion in the mesenteric valves. Therefore, a laparotomy was performed both to confirmation on condition and removal of necrotic. Her post-operative progress is good. Okay. Drains are removed and is now ready for discharge. So there is something missing there. That is, we have, okay. Stabilized with the fluid replacement and antibiotics. So if you needed to include that, you can include it here. So she was given IV fluids or fluid replacement and antibiotics. If you want to add that particular thing, you have to add it there. So that's it. There is a spelling mistake there. Sorry. Okay. Now, upon discharge, kindly continue monitoring her vital signs and medication compliance in addition to laparotomy wound care. So we have to say medication compliance. Okay, some medications are going. So we have mentioned it right now. So antibiotic fluid replacement is given. Right now, we have to focus on the medication compliance. She is having antibiotics. And we have to focus the vital signs because she is having atrial fibrillation and she is having the risk of falling BP. Okay, so she needs close monitoring. So that's what we need to say about the patient. We need to inform these things to the local community health nurse. And that's it. That's the end of the presentation. Have a nice day. Thank you.